A woman died after being given the wrong cancer treatment when her lab results were mixed up with another patient who had the same initials, an inquest heard. Jean Dowd, 68, was given an incorrect diagnosis of the type of terminal lung cancer she was suffering from following the mishap, the inquest heard. This meant she was given a different course of treatment than she needed, meaning she was, effectively, given no treatment at all, the inquest heard. Jean was started on a drug called afatinib in April, but she actually had a type of cancer which required chemotherapy, which could have prolonged her life, the inquest heard. Weeks later it was found that Jean's biopsy sample had been mixed up with another patient's who had the same initials as her, the inquest heard. Jean Dowd was given a different course of treatment than she needed, meaning she was, effectively, given no treatment at all, the inquest heard. Image, Internet unknown. Senior coroner for Plymouth, Torbay and South Devon Ian Arrow confirmed the cause of death as lung cancer and recorded a narrative conclusion. Image, Plymouth Herald. W.S. Jean, of Plympton, Devon, was first seen by consultant clinical oncologist Dr. Amy Roy in the Chest Clinic on March 15, 2017 and was diagnosed with lung cancer the same month. She died on July 9 at St. Luke's Hospice. Dr. Roy acted as a witness in court to explain how the incident unfolded, reports Plymouth Herald. She told the court how Jean's results came though in early April, which suggested she was positive for a mutation in her lung cancer, recommending that afatinib was the most appropriate drug for her. Jean began suffering side effects of the drug shortly after, including an unpleasant florid rash, and she had a sore mouth, the court heard. Jean Dowd died on July 9 at St. Luke's Hospice. Image, Science Photo Library Room. Weeks later it was found that Jean's biopsy sample had been mixed up with another patient's who had the same initials as her, the inquest heard. Image, Plymouth Herald. W.S. She was admitted to Derryford Hospital on April 16 as she was severely constipated, which was affecting her ability to eat and drink, the inquest heard. Dr. Roy agreed to stop the treatment and referred her to a dietitian. On the evening of May 25, Dr. Roy received the email to say the lab result was incorrect, which she discussed with Jean's family on June 6. By this point, Jean had not been put back on the cancer drug. Jean continued to deteriorate and was recommended to go back into hospital, where she received radiotherapy to help with her chest pain. She was then transferred to St. Luke's Hospice in June. Image, stock photo. Dr. Roy noted on June 26 that Jean was still very weak, but confident her pain was getting better, but she wasn't fit enough for chemotherapy, the inquest heard. Dr. Roy told the court Mrs. Dowd had advanced incurable lung cancer. Death was inevitable no matter what we did. Chemotherapy rather than afatinib may have given her a longer lifespan. She had the wrong treatment, which effectively meant she had no treatment at all. Coroner Ian Arrow confirmed the cause of death as lung cancer and recorded a narrative conclusion. Dr. Amy Roy told the inquest death was inevitable no matter what we did. Image, Plymouth Herald. W.S. Plymouth Hospital's NHS Trust, which runs Derryford Hospital, told the coroner measures have been put in place to prevent lab mix-ups from happening again. Speaking after the inquest yesterday, a spokesman said, "We apologize sincerely to Mrs. Dowd's family during the inquest, and we would like to repeat that apology publicly now. We are extremely sorry for the mistake, the delay in communicating this and the effects this had on Mrs. Dowd's treatment. Although Mrs. Dowd had incurable cancer, if the error had not been made, there is a possibility that chemotherapy may have increased Mrs. Dowd's life by a short period of time." Our senior pathologist gave the coroner detailed assurance regarding the changes that have been made so that an error of this type could not happen again.